everybody. I'm Christina Lords, the editor of the Idaho Statesman, and I want to welcome you to our first live Q&A on our coronavirus coverage. The first thing that I'd like us to do is acknowledge the 337 donors who recently gave to our COVID-19 local reporting fund. Through your help, we've raised over $22,000 from people in our community who have told us that they've relied on our coverage since March, when Idaho's first coronavirus case was announced to the public. This fund directly contributed to keeping our reporters and photographers working during a time when the news industry is going through really dramatic turbulence due to the fallout of the pandemic economically. Thank you so much to everyone who's donated and who's joining us now that was a donor. We had $10 donations to $1,000 donations and everything in between. And the messages that people left as they donated really lifted our spirits during one of the most stressful and crazy news cycles that most of us have ever experienced. So thank you. Today, I'm joined by arguably some of the most experienced and dedicated reporters who have been covering the pandemic in Idaho since day one. That's Assistant Editor Chad Cripe and longtime healthcare and consumer watchdog reporter Audrey Dutton. I'd like to start today's discussion by introducing ourselves for those of you who may not know us. I've been with the Statesman since November 2017, and I've been reporting largely in Idaho since I graduated from the University of Idaho's journalism school in 2009. I've reported on local and state government for the Moscow-Pullman Daily News and the Idaho Falls Post-Register, and I also served as the assistant editor for the Idaho Press before I transitioned over to the Statesman. I'd also like to give Audrey and Chad the opportunity to introduce themselves and their backgrounds. Chad, do you want to tell us a little bit about yourself?
Sure. Thanks, Christina. I'm Chad Cripe. I've been at the Idaho Statesman for 24 years. I came here right out of school. It's the only place I've worked. Mostly in sports. I was the Boise State football beat reporter for 14 years. I've been the outdoors reporter, sports editor, sports columnist. For the last year and a half, I've been the assistant editor, overseeing sports and doing other various things like coronavirus. And I also have a 12-year-old son, so I've experienced this through all of the disruption in schools and life that have come with that. So that's been an interesting part of this whole thing as well.
Right. Yeah. Audrey, do you want to introduce yourself as well?
Yeah, hi, thanks for joining us. So I've been with the Idaho Statesman since 2011. I am originally from Twin Falls and moved around quite a bit, and then got the opportunity to come back and work as a business reporter, covering primarily healthcare. So I moved back to Idaho in 2011. Since then, I've been doing business reporting, lots of data and public records work, and healthcare. You might have followed my reporting on the St. Luke's antitrust case several years ago. I also covered our healthcare systems and the Affordable Care Act, Obamacare, for several years. This is the first time in my career, just to kind of underscore how serious this pandemic is. It's the first time in my career that I have had physicians and nurses break down in tears during interviews. This is a very serious pandemic, and I think that just kind of shows it. So one of the things that I've been covering is the impact on hospitals, the impact on healthcare workers, and on nursing homes, and we'll get into that a little bit more.
Yeah, for sure. Okay, so just to kind of set us up, the first case of COVID-19 in Idaho was reported on March 13th, which seems worlds away from June 30th right now. I'm sure we all feel that. That was right here in Ada County. It was a woman over the age of 50 who had attended an out-of-state conference in New York City and traveled back through the Boise airport here. And we've certainly seen cases increase from there with a hotspot situation in Blaine County early on in the pandemic here in Idaho that made it one of the worst places for coronavirus per capita in the nation. Now we have 40 of 44 counties in Idaho that have at least one reported case, and community spread in 29 of Idaho's counties. Right now we're seeing large caseloads in Ada County and rising trends in Canyon County as well. Up north in Gooten County, they also had a big caseload yesterday that we reported on. So for this discussion and live Q&A, we invite you to ask questions in the comments, and we'll get to as many as we can. And while we're seeing those come in, I'll ask a few questions to start us off to get the ball rolling here. This first question will be, I think, mostly for Chad here. So early on, we started tracking individual cases in one story on the website. we initially wondered even how long we could keep that up and if we could keep it up. And now we're hearing from readers that it's an essential tool that they use each day to track trends and see where cases are spiking. So what was the reasoning, Chad, that we decided to start this kind of story file, and what have been the challenges to tracking each of these cases, and what's the value in keeping it going that you've seen?
Yeah, it was really just split second decision that, we were doing stories on every case as they came in, and I didn't think we could keep that up very long. So I threw them together just to sort of see where it went. I did not expect that we would have 5,000 of them tracked in there when we started it. But right away we saw the feedback from people, the readership on it, the people that were subscribing based on it, and that has continued throughout this entire time. And even when the cases got down to 20 a day, and some people are like, "Why are you still doing this?" The readership on that was still really high, and people come and check it every day. And for the longest time, it was the only place that I know of where you could get accurate county by county counts every day. The state has started doing some of that, but still, it is the best place. I think everybody would agree to get the historical record of how this thing has grown across the state of Idaho. And so the feedback we get from readers is that they really use it. And there've been a couple times I've wondered if we can keep it going, and but we have to. I mean, it's
Right.
too popular, and it's too useful. And I mean, we use it all the time. That's how we know that yesterday was the most cases Canyon County had ever had, and the most cases Kootenai had ever had, is by searching our record, because that's the only place you can really find it.
Right. And we also have at least two other kind of standing stories that we've kept on our homepage here and there, including kind of the same treatment of trying to track each death that we're aware of, and also where we're at in the stages meeting the criteria to be able to move out of these stages for our economic recovery. So just wanted to make sure that people were aware of those cases or those stories as well that we update regularly.
Yeah, and the deaths one, fortunately, we haven't had to update as much, so we don't highlight that one as often. But the criteria one also has been a big one that people turn to see where we're at, and it's a way to see how Idaho compares against the criteria the governor has set. And if you were following that, you could see that we weren't going to get out of stage 4, and that we're in trouble again this time.
Right. Okay. So the next question I think would be best answered by Audrey. So another area that it's been hard to kind of understand the trends and get public data surrounding our case totals has really been intrinsically tied to nursing homes and long-term care facilities. You filed a public records request in May for some pretty simple statistics on which of those kind of facilities had reported how many cases. What was the reasoning behind requesting this information? What reasons did Idaho Department of Health and Welfare for not initially giving that information back over to us? And how is that information now more available to the public since we did do that request?
So we asked for the information from the state. We also asked the different public health districts, can you tell us about your outbreaks? And we knew from looking at other states, Colorado in particular has a really good tracking sheet for their outbreaks. They even had a card tournament on there for the origin of an outbreak and number of people who were infected and all sorts of different things. So I had been asking various public health agencies, can we get this information? Filed a formal request to the state in May. And the same day they responded, we're not going to give this information to you. The reason that I think we need to have this information and why it's important is we know from the very first outbreak we had in the US that nursing homes, long-term care facilities, group homes, congregate living facilities where people are vulnerable are a place where this virus can hit really hard. So we need to make sure that we know what's going on in our communities as well. So the state, going back to what they said, the state had responded that they didn't want to give out the information or they were legally not allowed to, because it would potentially identify people. There were a couple of other reasons that they gave. What I had asked, to be clear, was a list of the facilities that had at least one case and the number of cases that they had. So we did not believe that would identify a patient. So our attorney sent a letter to the state saying, you have a few days to provide this information to us. We plan to sue if you don't, because we don't believe this complies with the public record law. So they did provide the information to us, and they've begun providing it to the public on a weekly basis on Friday. You can get it off of rebound.idaho.gov. It might also be on coronavirus.idaho.gov. I'm not sure, but it's available there, and we're also kind of periodically updating our own information on that, and we'll be using that information to look at places that have outbreaks. What was the record like? We're starting to see now that the state is doing targeted inspections looking at COVID infection control at a couple of facilities so far. So we'll be watching that. So if anybody wants that information, go to our website, reach out to me. I'm happy to help you find that. We have heard from people who have loved ones either in facilities or were looking at putting their loved ones in facilities. They needed nursing care or they needed more help. They want to know, does this place have an outbreak? And the facilities are supposed to be providing that information to families of the residents themselves. Like, they're supposed to be notifying people, and hopefully everyone is doing that. But we think it's important for the public to have access to that information.
Yeah, we got an email from a woman in Twin Falls who said that she had a family member in a facility, and that facility had not been, talking to them about what was going on, how many cases there were, those sort of things. And so while I'm sure many of these facilities are doing their utmost best to keep people safe and keep these families informed, there are examples of facilities here in Idaho that aren't doing that. And I think that was an important part of why we were pressing for this information. And I'm glad that the state is offering that on their website more readily these days, which is great. Okay.
Just one thing to add too.
Yeah.
Is from the start of this, I've heard from people who work in these facilities, and I've heard from families of people who are in these facilities. The staff are doing their best.
Right.
And in cases, they didn't have access to adequate PPE. That's a problem nationwide with the PPE shortage. It sounds like it's gotten a lot better, so that's good. And one of the kind of good things that we've seen with the release of this data is that a lot of the facilities, their outbreaks have been small or have been controlled at a fairly low level. So, and there are 400 or so facilities like this in the state, and so far it's been a fraction of those.
Gotcha. Okay. So this is a question for both Chad and Audrey. What other difficulties stand out in your guys' mind as you've tried to gather information that could help the public understand what's going on around them? What data does the state not release that you've noticed residents have asked about? I know we've gotten a lot of questions about hospitalization rates and things like that. Can you kind of walk us through some of the obstacles that not only Statesman reporters, but reporters statewide are facing to get this information out to the public?
Yeah, we've written several stories about data that Idaho doesn't have that other places have, data that has been inaccurate. So that's been a huge issue. We get, Rachel and I, who do most of the work with the daily numbers, we get hammered on Twitter every day from people who are like, why aren't you saying that the hospitalization rate is really low? Idaho doesn't have a hospitalization rate. We have no idea what it is. Why are you not saying the death rate is really low? Well, again, there is no death rate for this. We can tell you how many of the known cases have died, which is about 1.5%, but there is no death rate for it. So how many, there's people want to know how many of these patients are asymptomatic. We have no idea. There's no way for us to know that. So some of this is done, is just you can't do it in this time frame, but some of it is available in other states, and we just don't have it here. And the hospitalization one in particular is a big one. If we knew that there were only 20 people hospitalized right now, certainly we would report that, but that doesn't exist. The hospitalization number the state puts out is an aggregate total since the beginning, updated as they close out investigations. And so even if they add 10 hospitalizations to the total like they did yesterday, that doesn't mean 10 people got hospitalized yesterday. That just means they closed out 10 records that had hospitalizations included in them. And so that's been a huge challenge. And then the inaccuracy, or as they say, more incomplete, which I understand with epidemiology, they are used to this data changing day to day. We are not used to that. And that's been a really big challenge for us, is that these numbers change, and sometimes they can't explain why the number was this yesterday and it's now this today. And so that's been a really hard part of this. And then the other part is, the communication has not been great. And again, Idaho Department of Health and Welfare and Central District Health and these other health districts, they're not set up to be the most in-demand agencies in the state for the media. But, one example we wrote about is, I asked repeatedly when this criteria started, how are you going to decide whether there's an upward or a downward trend in cases? And the only thing they would ever tell me is, we're going to use a 14-day moving average. And they gave me this long explanation of why it's going to be a 14-day moving average. And then they scrapped that without telling anybody and decided to go to compute it in a completely different way. And so we were tracking it one way, and then all of a sudden we're doing it this way. And they did that with the way they track healthcare workers. They started doing it one way, then they flipped it to another way. And so that also has been a big challenge for us. It's, this sort of shifting data.
I think another thing to point out too is how the coronavirus is affecting our minority populations here in Idaho. Initially, we had very little to none information about how this was affecting our Latino populations, our Native populations. And so that's another thing that I think that we wish we had more information than we do right now. I think certain health districts are doing a better job of trying to collect that information as these cases come in, but I think it's still something that we need to learn more about, so that we're doing our jobs to help these populations that are affected by this virus be able to make smarter decisions about where they're going and wearing masks and things like that. I think that's another area that I think Idaho could do better on.
So yeah, to that point, Christina, if you look right now, the state lists 5,752 confirmed and probable cases in Idaho. They only have ethnicity data for 3,494 of those. So
right.
There's 2,300 cases they don't even know.
Right. Okay. Audrey, anything that you've run into as far as talking to healthcare workers and how some of them have been instructed not to talk about their experiences to the press or to others? Is that a situation that you've run into when you're reporting?
Certainly. And that's a situation that is kind of always the case. Healthcare is a particularly difficult area because public records often don't apply. We need access to an individual's medical records by them giving permission in some cases. And healthcare workers don't want to violate their patient's trust. They also are concerned about losing their jobs if they were to speak up. So a lot of my conversations are off the record or on background. I've given out my cell phone number to be passed out to many healthcare workers, and I've heard from a lot of people, and it's been instrumental in reporting out some of our stories. If anybody wants to reach out to me or have a family member or a loved one reach out to me, please do so. I will not quote you without your express permission. Going back to kind of what sticks out as difficult to get information on, hospitalization numbers are definitely an issue. That's been an issue from the start. We didn't know how to get the census data for each hospital on a daily basis. There wasn't a state system for that. I found out yesterday from Health and Welfare that some of the hospitals, I don't know how many, do report through a federal system the number of COVID hospitalizations they have. That number is reported on a federal website. This is a whole theme. It's like the difference between the local, the state, and the federal reporting, and how there can be conflicting information there. And so there is a number reported on a federal website. However, the confidence interval, the accuracy level is really broad. So it's like night and day difference between what the lower might actually be and the upper might actually be in how confident they are in the statistics there. So we're trying to get more information about that and see if there's a way to get a little bit more accuracy in how many COVID hospitalizations there are. It's been kind of confusing to us going through this and learning about how the various systems work and systems that aren't built yet, how to get information and where it's stored. So we're working through that every single day, all day long, trying to figure out how to get information. And Chad's done a lot of that work too.
For sure. Okay, so we know that parents and students, teachers, and student athletes have all faced unique challenges as the states navigated the spread of this virus. The end of the spring semester was completely upended for K through 12 students in the Valley, including for Chad's own child, who he is helping with coursework at home and things like that. So what are we hearing now from the state and local districts about how K through 12 students will be taught in the fall, And is it too early to predict how and when students will be back in the classroom come August and September?
Well, it's really, I mean, it seems like it's going to be district by district as this whole thing started out. I am more familiar with the Boise School District plan, partly because that's the one that affects my personal life. They at this point are saying they're planning on the kids being in school. They are taking the approach that they're going to be in school every day, where some places have said we're going to do every other day or whatever. Around the country, you've seen things like that. They have taken the approach that they're going to be in school every day. They have said that they have, there's been a lot of communication around if they're not in school, there will be an actual robust online learning system for them, because what we had in the spring was, as a parent, was completely unacceptable. I mean, it was nothing really. And so, they are saying, and we actually, our son just did 2 online summer school classes last month. And, that system was really good. And if that's what it was, okay, I could live with that. But so I think it's still a huge unknown. I mean, you look at what's happening as colleges are trying to bring athletes back to campus. It really makes you wonder how realistic this is, that we're going to be able to stuff 30 school kids in a classroom that just doesn't have the space to spread them out. So I don't know. I mean, I think they're trying, but there's part of me that's really skeptical of how this is going to work out.
Yeah. Yeah, and it seems like the governor has really tried to make local control the way of deciding this. That the State Board of Education has really delegated this to local school districts and trying to do the right thing that's best for them. Some of them don't have enough one-to-one technology to have computers or tablets home for their kids. So that's a huge issue. I know one of my friends who's a teacher for the Nampa School District, they expanded the Wi-Fi around her school so kids could come and sit in the parking lot and do their homework if they didn't have, internet access at home. And so there's a lot of different challenges that I think people are facing. And it will be interesting to see as we get further into the summer and closer to fall what those decisions will be. You kind of alluded to this earlier, Chad, but this has also really greatly affected collegiate sports in a way that the NCAA has never experienced before. Practices have been scheduled and canceled. Student athletes are being tested for the virus when they return to campus. And we've also had positive cases here at Boise State, both in athletics and just in the general, school departments. So what's happening right now at Boise State to keep these students, coaches, and athletics staff safe? And do you think it's possible that there's a future that does not include collegiate sports come the fall?
Yeah, our Boise State beat writer, Ron Counts, actually has a story that went up this morning detailing, Boise State's, I think it's 37-page plan for, how they're going to deal with this issue. But they haven't even got to how they're going to deal with practice. I mean, right now it's off-season workouts, which that, you can realistically space people. But, the part I keep coming back to is major college sports has not held a practice. Major League Baseball, the NBA, the NHL, the NFL, none of them have held a practice yet. And there have been all these reports about people testing positive and how are we going to make this work? I mean, the PGA Tour keeps having people have to withdraw because they've tested positive. So you start putting all these people together to play football, to play soccer, to play basketball. I don't see how it works. I mean, unless somebody makes the decision that we don't think this is a serious enough illness and we can just let people get sick, I don't see how you can have. I don't see how you can have sports this fall. I don't see. Baseball is going to be really interesting. I mean, they start workouts I think on Friday, Major League Baseball, and to see how that goes, because that'll be the first really, real practices to see what happens. But I just don't see how they can do it unless, like I said, they just decide that it's not that big a deal, and we can deal with people getting sick. I mean, football, you hear like Clemson's had all these guys get sick.
Right.
Well, you've already through a football season, you only have so many guys who can actually play. You've got 100 guys on your team, but you've only got maybe 70 of them that are actually ready to play football. You know, you get 10 of them hurt, and now 10 of them have coronavirus. You might not have enough guys to play a game at that point. And I've seen people already saying, athletic directors already saying, yeah, we're going to be able to play. I don't know if we're going to get to play every game, but we're going to get, like, man, that's tough. You start talking about you're gonna have to cancel games, 2 days before the game because people are sick. I don't know. I'm very skeptical.
What are the financial ramifications for that, for losing out on these major sporting events? Like, how does that affect the athletic department's budgets and Boise State or any college's financial situation?
Yeah, and I mean, to me, that's the only reason that we're even talking about playing college football this fall is the millions and millions of dollars that are riding on it. And these aren't, people talk about how much money college athletics makes, but for most schools, it's a break-even proposition. So you pull out $4, $5, $6, $10, $15 million in revenue. Where are you going to cut all those expenses? I mean, coaches' contracts do have language in them that essentially, if we don't have the money, we don't have to pay you. So, I mean, could they get out of some of that? I don't know. But the financial ramifications are huge. I mean, you talk about Boise State, they're still paying, they've built all these facilities to support this program. Well, they're still paying the debt on all of that stuff. So that even if you're not playing games, you still have to make those debt payments. You still got all this personnel you got to deal with in some way. You've still got all these scholarships. So yeah, it's a huge amount of money, and the schools aren't set up to absorb that.
Yeah, for sure. We've gotten, go ahead, Audrey.
I wanted to just chime in on testing.
Yeah.
So athletes and sporting events are lowest tier in the testing recommendations. And this has come up a couple times.
And these are testing recommendations from the state, right?
Correct. Yeah. The testing task force has put together testing recommendations, and they have tiers. They have 5 different priority groups, and groups 1 and 2 are people you might expect, like folks in nursing homes, folks who work in essential services, healthcare workers who are showing symptoms, those sorts of things. And then you get kind of lower in the priorities. And Boise State Athletics has been able to test its folks. One of the questions that I have is, why is it that we jump to this level when this top level is 40 some thousand people, but our state only has capacity to do 20,000, 23,000 a week or something like that. So we don't have enough capacity to test the top tier, but we found it for the bottom tier. And I have no idea what the answer is for that. Chad, do you have any idea?
I don't, other than, they do have a contract, as I understand it, to do some of the testing. I also think it's gonna be interesting. They did a lot of the athletics testing, which, not very many of those came back positive. Last they told us it was 4. But that testing was primarily done in early June before the demand got really high. And so I think that may have helped them. As they bring people back next week, if they're able to reopen campus, I wonder what that's going to look like. Because when Boise State sent out their email to the campus letting them know they were shutting down campus last week, they did talk about there being having a harder time getting a hold of testing. And so I think they may have gotten fortunate a month ago that the demand wasn't real high, but as the cases have taken off, the demand has gone way up. And so we'll see what happens the next round.
Audrey, could you talk a little bit about how we have a capacity to test, but we're certainly not reaching that capacity each week or each month? What are some of the holdbacks to that we know of? Why we have the capacity to do so, but people aren't being tested to that capacity? Why would that be happening here in Idaho?
So if you think of testing as a thing that requires various component parts, like you can have capacity to make 5,000 engines and not make 5,000 cars. It's sort of the same thing with testing. You need to have the testing kit. You need to have a chemical that can transmit the test if it's one that's being sent away. You need to have the people to actually perform the test. So for the tests that we are most familiar with, the PCR, it's a nasal swab. So you need somebody to be able to swab your sinuses.
Get up in there. Yeah.
And what I've heard from when I talked with Crush the Curve, they have lab capacity, which was a really big issue for a long time. We did not have enough lab capacity. They were running 10 to 14 days behind. We're hearing some of that again, but Crush the Curve had a lab that could do 16,000 a day. However, they needed medical partners, the people to staff it, and they had insurance considerations. So you can't just stand up a testing facility in a parking lot to have it associated with some sort of healthcare facility provider. So the issue that I think the state is grappling with right now is how to coordinate things a little bit better, so that when we have a lab that can do 16,000 a day, where do we find the personnel? And you can't obviously just make up healthcare providers and people who can perform the tests out of thin air. You can't just create them. So we do have an upper limit there. And meanwhile, hospitals need to be seeing patients. So they can't be spending all of their resources on testing people. And that's just something that I think we're going to continue to probably see the same issues that we've seen for the past few months, where certain pieces of the resources will be in better shape than others. For a while, it was like Q-tips were in short supply. And then in various parts of the state, they have better access than others. Small family medicine clinics, types of things. I was hearing from, in 2 months ago, I was hearing, we don't have any idea how to do more tests. We just don't have access to the materials. So it's definitely going to be a tough journey. One of the things that a lot of people have been stressing is testing is not the only reaction we have to this virus, and it's not the only way to prevent. Testing, contact tracing, and quarantine are key pieces. You need to know someone's been infected so that they can tell you who they've been in contact with, and then they can quarantine, and those people can quarantine, and those people can get tested. But we also need to be doing things like wearing masks, washing our hands, proper hygiene, social distancing, not going to large events. We've seen so many outbreaks associated with large events. So testing is a really big piece of this, and it's a piece that a lot of people have focused on, and the state and public health agencies have too. But it's definitely not the number one, not the only way to respond to it.
Gotcha. Okay. We've had a lot of questions I've noticed on Twitter and other social media about how do we navigate between these stages, and what does that mean, and who makes these decisions. So, last week, Central District Health, which oversees several counties here in Southwest Idaho, moved only Ada County back to stage 3 of the reopening process due to high caseloads, largely found in young people. That forced bars and nightclubs to close and caused a lot of confusion about which establishments could open and which ones would have to shutter their doors. So who makes these decisions? What are the criteria between moving in between stages? And I think there's a misconception that we have to go back if we don't meet these criteria. And Chad, can you kind of explain that that's not necessarily the case?
Yeah, so we've got two different systems now. We've got the state of Idaho system and the Central District Health system. So the state of Idaho system, there are 6 criteria. We have to meet all of them to advance. If we don't meet all of them, it is up to Governor Little whether we stay put or go back. He can kind of do what he wants to do there. Through the first few stages, we kind of breezed through them. Stage 3, we really should not have advanced out of, and we did. And it goes back to what I was talking about earlier with they kind of changed the way they were computing some stuff. And they decided that basically the way they do it is they don't look at what happened the last 2 weeks compared to this 2 weeks, which is what most people would look at. And healthcare workers infected went way up. They looked at what happened on day 1 and day 14. And because of the way the numbers fell, it showed a downward trend. So that's how we got out of stage 3. Stage 4, we failed 2 of the metrics. One of them being cases going up, the other one being healthcare workers being sick going up. And so he kept us in stage 4 for 2 more weeks to evaluate again. Right now, if stage 4 were to end today, the exact same thing would happen. We would fail again. be up to him whether he moves the state back or just keeps it going in stage 4. We don't know what the difference between stage 4 and completely out of the system is, because he hasn't said what the new. Presumably there will be some sort of restrictions and social distancing, but I think we just don't know what that's going to be. So then he said the other day that we're really going to now to a regional approach, which is going to allow the health districts, the counties, the cities to decide what they want to do based on what's happening on the ground there. And that's where Central District Health stepped in and moved Ada County back to stage 3 minus bars, closing the bars. Their system is much less cut and dried. So they've got criteria, but they are recommended criteria to look at. And there's similar sort of, there's more of a could move forward, could stay put, could move back. But it's not cut and dried. So one of theirs is if Central District Health, which includes Ada, Elmore, Boise, and Valley counties, has 100 cases or more per day, or 100 or more new cases for 3 consecutive days, they can, in the middle of a stage, move us back a stage, but they don't have to. Well, we hit that last week. We will probably hit it again this week, but their Board of Health does not have a meeting scheduled, at least as the last time I looked, did not have a meeting scheduled to do that. So how serious they're taking that ability to move us back, I don't know. And so again, it's a 2-week window. They're going to evaluate, I believe, next Monday. Although they messed up the way they started the stage, and so the stage didn't start technically until last Friday, so they may have to wait another week. That's still kind of unclear also. But that's the Central District Health Board of Health. And then within that, the mayors can add on if they want. So we've seen Lauren McLean do that, where the state has said one thing and she's made it more strict. So the mayors are able to do that as well within these. So it's, I think we're going to see more and more of that going forward, where it's very community based.
Yeah. And I think the governor's talked a lot about that as far as the state's responsibility, and he's taken some political heat for how he's handled the pandemic, and even the Speaker of the House sent him a letter saying we think that this control and these decisions should be made at the 7 health district level. So he's facing political pressure as well to make these decisions and to regionalize these approaches. So it'll be interesting to see how much of that, continues to play a part in what goes on. So we actually sent out a Google survey to readers to see what their questions were, and I want to move into some of those. One of the ones that came up over and over again are, why aren't masks mandatory in Idaho? As people are concerned about our economic rebound, wouldn't masks help businesses be able to stay open and give consumers confidence that they're safe in these environments? And we've seen, I think it's up to, at least 11 when our editorial board came forward and said that Governor Little should make masks mandatory in Idaho. We're seeing more and more states and more just local decisions on that front as well to make people wear masks when they're in public. Why aren't they mandatory yet here in Idaho, and who makes that decision for us?
I think it's a political issue. I think at the end of the day, it shouldn't be, but it is. And, I don't see the state of Idaho, unless things get really, really bad, requiring masks, because, you just look at the politics of it. I do think there's a chance that Lauren McLean does it in the city of Boise at some point, particularly if things get worse. But yeah, I just think politically it's not going to happen at the state level.
And there was discussion from Central District Health that they're at least thinking about that option as a way to curb these rising caseloads here in the Treasure Valley, at least. We also had a question about ICU beds, Audrey, that I want to get to. We reported on ICU beds at the very beginning of this. Can we talk about how that works, how many we have? Are we prepared if there is a surge here to be able to handle this in ICU?
Yeah, this has been a really difficult topic, because ICU beds come in different types. So we have information from a couple of different sources, and we were able to do a story pretty early in the pandemic. At what point will our hospitals be overloaded, because we were seeing what was happening in New York and Italy. And we're trying to figure out at what point do we get there. And of course now, it's part of the criteria. And ventilators, also ventilator availability. We need to have both of those. So ICU beds are it's not just a bed. You have to have proper staffing for them. You have to have adequate nursing staff for them. But there are different types of ICU beds. So they can be pediatric ICU, regular ICU, surgical ICU, cardiac ICU. So trying to figure out what the number is of ICU beds has been kind of difficult. We do know that we have, it's in the neighborhood of 400 to 500 adult ICU beds in the state. And the state does have, in its daily data updates, and then looking at this when we're looking at moving to different phases, it does look at the availability of ICU beds. What we've seen is some of the numbers have dropped down of availability, and that's initially, it's really concerning to see that. But we also know that hospitals have resumed doing elective surgeries, and in some cases that may require an ICU bed. So it's not necessarily a giant wave of COVID overtaking our ICUs. And, some of the things that we're seeing with treatment too are kind of adjusting themselves. Like, we're not seeing that necessarily putting someone on a ventilator right away is the best idea. Just physicians and scientists are learning more about how the disease works and what works best for people. So, we might see that we have more availability than we expected to in some of these areas, just because they're figuring out that it's better to treat someone just on oxygen or send them home. But hopefully we don't get to the point where it becomes critical, because then we move into needing to implement standard of care sort of emergency plans. And
Arizona is looking at that right now, right?
Yeah.
I mean, so there, I think one of the things that I hear from my friends and family are, well, New York City's taken care of, cases are coming down. We're not seeing these surges like we have, in April and those sort of places. But I mean, Yakima, Washington is going through this right now, where that's 5 hours away from here or so. Where they're having to send patients to Western Washington because they can't handle the influx of COVID patients in Yakima. So it does seem like we're not out of the woods when it comes to that type of care quite yet, unfortunately.
And we need to have healthcare workers healthy, because if the healthcare workers start getting sick, then they need to be quarantining. They can end up being patients. We've seen that all around the world. So, yeah, but the question of how many ICU beds do we have is a really tough one to answer, and I don't feel confident answering it, to be honest.
Yeah. What are some of the biggest misconceptions you guys have noticed as we've covered the pandemic? What are some of the questions that you get that hopefully people would understand by now, but they still don't, about what we're covering and how we're covering it? And
I mean, the biggest one that we get every day is just the people that think that it's not a big deal, that it's, 472 cases in one day is not a big deal because our hospitals are not overrun. And we don't know. And that's the thing. I mean, if I knew that 472 people got sick and not one of them was very sick, well, that'd be great. We'd report that, but we don't know that. And so I think that's been a big part of it, and you just see over and over, people are like, oh, everybody's going to be fine. 99% of the people are going to be fine. And I think we all know that if you read what's gone on around the country, just because someone didn't die doesn't mean they were totally fine either. There's a lot of people who've had very serious illnesses that have lasted a very long time tied to this. And we just don't know. We don't have any data. So we've stayed very much away from like saying this is good, bad, indifferent, whatever. We're just reporting here's what's going on. It's spreading. You can make your own decision, I guess, about whether it's good or bad, but it's spreading, and it's spreading in a way that it has not spread before. The other one that we didn't talk about during the data thing that frustrates me is, the state puts out a recovered number. And so, people can look at that and say, oh, well, all these people recovered. Well, they're estimating people are recovered based on the fact that they're still alive. That's what that number is. And so we list it in our daily story, but we don't make a big deal out of that number, because that doesn't mean that people are okay. That just means they didn't
You don't know
die.
the conditions of those people, that
Right.
they're just not, they're not dead yet.
And so there's just so much limitation to what we have available to us to work with. And I think that's the biggest thing, is people want tons of information, and so do I, and so does Audrey, and we push for it all we can, but a lot of it just doesn't exist.
I wonder if you guys, oh, go ahead, Audrey.
Sorry, it's difficult too for the public health agencies, because they're the ones who are trying to gather this information. And imagine not having to deal with something like this, and then suddenly 2 weeks goes by and you're swamped.
Right.
You have to be hiring contact tracers and training people in how to handle this stuff. I also wanted to talk really quickly about not misconceptions, but the fact that we don't know a lot of the long-term stuff about this virus. I mean, when this first started out, we thought children were totally fine. And we learned later that actually there's multi-system inflammatory syndrome in children that can put them in the ICU and they end up with kind of the same stuff that the adults are having. Very rare, which is good. But it sort of underscores the issue that, for, I think it was months at that point, we thought that children were just going to be totally fine. And it turns out that's not true. And we also are learning more about how this is affecting cardiovascular. We know that there's some issues with blood clotting. And I think it's just good for people to keep a kind of flexible mindset about this and understand that we don't know a whole lot still, and we probably won't know a whole lot for a while. And just kind of, we're learning as we go. And we at the Statesman are trying to be as careful with how we report as possible and give you guys context so that you can make better decisions with your lives.
And you recently hosted a panel discussion about vaccinations and where we are in that process. Can you kind of give us the headlines from that panel discussion and where we are with vaccines? It still seems like that may be still quite a long time away. What did you learn from that experience?
We talked with some researchers, some folks who've worked on other vaccine things like HIV, SARS, Ebola, and one person who works in the industry that's working on a vaccine. And they all kind of said early next year, hopefully, but expect that there will be several types of vaccines. So we often think about the flu shot as one flu shot. And what we're going to see with COVID is likely several different types of vaccines, hopefully going live as soon as late this year for early distribution, maybe early next year, summer. The people who are most likely to get the vaccine in the early stages are probably the same people who are at the top priority for testing for those reasons. There's also likely, I think this may be more of an issue in Idaho than in other states, but we'll likely run into vaccine hesitancy. So people not wanting to get the vaccine, and that could hinder the ability of the vaccine to actually provide herd immunity. Because certainly with any vaccine, there are some situations where people can't get them. So we need to make sure those people are protected as well.
The other, Christina, you mentioned misconceptions. The other one that comes up a lot that I forgot about is people who think that the cases are going up because our testing went up. And I've tried to explain this to people, but our testing went up May 24th. The first 3 weeks of new testing, the percentage of positive tests was like 2 to 3%. The week of June 14th, that went over 6%. So it was not that we started testing more people and suddenly we had more cases. It was several weeks of new testing before new cases started showing up. It was that we had, as Central District of Health has said, we had an outbreak tied to lots of people getting together, and that's where it started, and it just spread from there.
Okay, I kind of want to end with how has covering this pandemic affected you personally, and how is it different from other big stories that you've covered during your careers? I think this is probably the craziest news cycle I've been through. We're all still obviously working from home. McClatchy employees are being asked to work from home through Labor Day. So we've been home since mid-March. That's just one example of how strange this has been, that we're not able to get together and discuss news and brainstorm story ideas. But how has it affected you and how you do your job, and how has it affected you personally?
For me, I mean, obviously a big learning curve, because I spent most of my career in sports dealing with stuff I hadn't dealt with before. As you said, the communication has been really hard. I mean, I have seen one member of our news staff in person in the last 3 months. And that was just briefly because I happened to stop by the office on like a 7 o'clock on a Saturday night to pick up something off my desk, thinking nobody would be there, and one person happened to be there. So that's been really hard. And we've gotten, because the sports staff reports to me, trying to find ways to use them and helping them make this adjustment too. And Rachel Roberts has been the chief example of that. She 5 nights a week, she's doing coronavirus data stories for us. And so that's all been, professionally, a challenge and working through it. And, personally, early on, it was just the pace of it. Now, I mean, even, I've dealt with this a lot over the years in sports, but that first month or 6 weeks or whatever, it was just chaos. Yeah. I mean, they were, cases were getting announced at random times all through the day. And it was just trying to keep up with it was impossible. And we were trying anyway. It's gotten much more manageable the last month or so.
What about you, Audrey?
Yeah.
As a healthcare reporter, how are you doing?
So, this affected my mental health for quite a while, to be honest. I had nightmares a lot. I also have a 2-year-old who is not in daycare now. So very early on, when our daycare had first closed, and I was getting tips on my cell phone, email, just basically any way that someone could reach me. I was getting tips at least once an hour, probably. And they were legitimate tips, like, you really need to look into this. So it was a lot in the beginning. It slowed down a lot. I think just because people are getting more used to what's happening. And I think people are also adjusting to the fact that you're probably going to know somebody, and you might work with somebody who has this, and it's not necessarily something that the news would report. But yeah, it's been difficult to juggle everything. I think the biggest difference reporting on this over anything else is how much I'm hearing from nurses. It's one of the more difficult professions I've had in hearing from people. My mother's a former nurse. I know a lot of nurses. My mother-in-law's a nurse. It's never been easy to get nurses to reach out to me. And they have during this because they care about their patients. They're alarmed by what they're seeing. They're worried about their own health. They're worried about their family's health, about bringing home the disease. In some cases they've been furloughed or had coworkers furloughed. So I'm very glad that people are reaching out to me. I know it takes a lot of trust to do that.
Yeah.
And I hope that people continue to, and please pass on my contact information. It's on our stories. Our email addresses are, but personally, it's been tough to juggle. It's also been one of the most rewarding times. A healthcare provider I know had messaged me early in the pandemic and said, "Do you feel like this is like what you've been preparing for all these years?" I feel like this is what I'm ready for it. And I said, I don't know if I'm ready for it, but I do kind of feel that way. Like I understand the healthcare systems and how the healthcare industry works and health insurance and things like that. So I feel a little bit prepared for this, but also this has just been, we've just learned so much about public health and how our state operates and just all sorts of things we never imagined.
Well, and I think too, it'll be interesting as time goes on to do, hopefully as we get out of this, to look back and see what were some of the dysfunctions and the communication breakdowns, that we're trying to report in real time. But once we get a chance to breathe a little bit, I think we'll be able to dive more into some of those long-term changes that this might bring about for our public healthcare system. And certainly appreciate all the nurses and healthcare providers being on the front lines of this thing. I think we can't, end a discussion about this without saying thank you to those folks. Certainly appreciate what they do. So we're about out of time for our discussion today, but I again want to thank our generous donors who have contributed to our journalism fund, that have kept people working in our newsroom. It's been, a challenge for the journalism industry during this time, and we thank you for our subscribers who have literally kept us going and kept our doors open. That's not an exaggeration. We're seeing news outlets across the country fold permanently. We had a newspaper in Payette that recently went out of business because they don't have advertisers for their print product. And so without our subscribers, we really would not be here doing this, and we would not be able to give you these stories. So thank you for that. Thank you to Audrey and Chad for their time and dedication to covering this really complex issue for the Statesman. I think you've been exceptional during this time, and I get reader notes all the time saying thank you for your persistence and your abilities. It really has been an honor to work with you through all this. And thank you for watching and contributing today. For those folks that are tuning in, this video will be available on our website, on our Facebook and our YouTube channels if you'd like to share it later. And I think we'll say see you later, and have a good afternoon, everyone. Thanks so much for tuning in.
Thank you.
Thank you.
Bye, everyone.